Many rescuers have difficulty with bag mask ventilation. The American Heart Association recognizes this by recommending two rescuer bag mask ventilation whenever possible. The primary technique for adult two rescuer bag mask ventilation is the double EC clamp. The main components of two rescuer adult bag mask ventilation with the EC clamp consist of rescuer positioning, mask placement, EC clamp, head tilt chin lift, seal, and squeezing the bag. Adult two rescuer bag mask ventilation should be performed with rescuer 1 standing or kneeling at the top of the patient's head and rescuer 2 positioned aside of rescuer 1 adjacent to the patient's ear where they are able to comfortably squeeze the bag. Rescuer 2 can be positioned on the left side or the right side of the patient. Proper mask placement is essential to effective ventilation. The apex or the angled portion of the mask should be over the bridge of the nose, and the bottom of the mask should land between the patient's lower lip and their chin. Many images and videos of the EC clamp depict the C at the lower end of one edge of the mask as depicted on the left. This does make a beautiful C, but it would be more effective for you to move your C higher up on the mask as pictured on the right. This allows you to put more uniform pressure over the mask, and for our rescuers with smaller hands, allowing the thumb to be higher on the mask allows for a better reach for the E portion of our EC clamp. The bag has been removed to give you an unobstructed view of the full EC clamp. As you can see, the C is nice and high at the top of the mask, and the tips of the three fingers are on the bony part of the jaw. Now place a second EC clamp over the first EC clamp. With our double EC clamp in place, we are ready to do a head tilt chin lift to open the airway. Opening the airway is a necessary component of effective ventilation, and actually if you were to look up at the ceiling right now and gently raise your chin in that direction, you can actually feel your own airway open up, and that's what we're seeking to do with the patient with a head tilt chin lift. Even with an effective double EC clamp and an effective head tilt chin lift, we still have to seal the mask to the patient's face. As long as we have not adjusted the fingers of our E when we did our head tilt chin lift, then we have essentially created a hinge. Instead of squeezing with your fingers, if you push down gently with your thumb over the bridge of the nose, that pressure will be uniformly dispersed throughout the mask to create an effective seal on the patient's face. Now we are prepared to ventilate the patient by squeezing the bag gently over the course of about 1 second until we see chest rise. Remember, if you choose to use two hands to squeeze the bag, make sure that you aren't inadvertently doubling your ventilation volume. Both rescuers are responsible for ensuring visual chest rise and for noticing visual abdominal rise. Putting it all together. Rescuer 1, place the mask properly on the patient's face. Put your thumb up high on the mask, tips of your three fingers on the bony part of the jaw. Second EC clamp over the first. Head tilt chin lift, lean over the bridge of the nose. And rescuer 2, gently squeeze the bag until you see chest rise. If you lose your seal or the chest does not rise, take a deep breath and reset. Pick up the mask and place it back on the patient's face. Thumb up high, tips of your three fingers on the bony part of the jaw. Head tilt chin lift, lean over the bridge of the nose, and give a gentle ventilation next time around. Finally, practice. Adult two rescuer bag mask ventilation is often described but not performed during many BLS courses.